to explain. These are the innovations I'm thinking about. Do this, you patent them, and then you don't have to go to work. Even if there are lockdowns, you'll be comfortable working from home.
My name is Henry Opondo. I'm the current chairperson for Kenya Society of Physiotherapy. Kenya Society of Physiotherapy is a registered entity by the government under the Society Act. The mandate of the society is to advocate for the welfare of all physiotherapy stakeholders. Here, physiotherapy stakeholders include physiotherapists themselves, the patients, the vendors, the people who supply us with essential commodities, assistive technology like crutches, wheelchairs. Those are physiotherapy stakeholders, and also insurance. It could be private or public. We are here for an East Africa Scientific Conference. And to us, why this is very important is because we have seen, as a nation, the effort that our government has done towards bringing collaboration of what we call the East Africa Economic Bloc. And we've seen the three spheres that they're trying to have mutual benefit. That is political, economic, and social factors. Those three factors, we truly appreciate that in one way or the other, they can affect health. Take, for example, Ukraine, politically unstable. People are injured. That injury is a cause of ill health. Talk of economic. When a country is struggling with economic burden, people will struggle. People will not have enough to seek medical services on time. Talk of social factors like beliefs. You get communities that believe if you have a child who is born with a condition like cerebral palsy, then you are bewitched. They hide these children in the community. That itself is a determinant to health. So in that concept of enhancing mutual benefit across three factors, we are also now bringing our colleagues in different countries under the physiotherapy docket to collaborate, enhance, and see how best we can have what we call the best evidence-based scientific approach to manage the different conditions that exist within our East Africa Assembly. That is the main objective, to understand the uniqueness of each country in terms of health population, the health needs specific to physiotherapy. Because for a long time, and we've seen it, that physiotherapy, people tend to hear about physiotherapy when they're in pain or when they're in crutches. In the concept of universal health coverage and primary health, which is still aligned to what we call SDGs, Sustainable Development Goals, we must put physiotherapy at the primary level, at the forefront. We must look at physiotherapy not only for sick people, but as a preventive modality, because we hear non-communicable disease is on the high. So we are trying to see how can we come together, how can we appreciate the little data we have, the little knowledge we have, we enhance it together, we enrich it with the emerging trends and optimize our training, opportunities, and treatment. The second agenda is also for us as physiotherapy in East Africa to come up with something called subgroup. It is a legislative structure that we want to put. Just like we know the countries, the 7 countries, they have a structure that is put, and that's why they have their headquarters in Tanzania. We also want to have a structure we call a subgroup that can promote, advocate the special needs of our population. And why am I saying that? It's because physiotherapy, it's worldwide, and at the top of the globe, we are headed by what we call World Physiotherapy. The headquarters are based in UK. Now, under World Physiotherapy, we have what we call World Physiotherapy Africa region. Just the same, you'll get America region, Asia region. Under Africa, we also now have different subgroups. We have East Africa, the West, and so forth. So we want to strengthen our own East Africa bloc to enhance a collaborative approach to offer the best clinical services, as I mentioned, but also advocate for even cross-border employment.
In the ministry, we have physiotherapists who are working in the private sectors. We have those who are working with the national government, with the government, that is the general government. That is, we know that we have two levels of government, the county government and the national government. Afia House is a national government, and we have a few facilities which are within the national government, that is Spinal Injury Hospital and Madare, which very soon will become a saga. But for now, they are still under us, and MTRH, that is Moi Teaching Referral Hospital. And so at the national level, those are the facilities we have. At the county levels, all the counties are represented, and so they have the county referral facilities besides the sub-county facilities. And so we have several facilities, and we have a population of physiotherapists in the country which is more than 2,500, and they are all must be registered by the Physiotherapy Council of Kenya, so that to be able to be given license to practice. Our law provides for provisions for registrations of clinics, and also those who do not follow the regulations, there are penalties for the same. So as a council, we usually do regular inspections around the country, throughout the country. We do it regularly. But first of all, we do inspections of clinics, all the clinics and health facilities that offer physiotherapy before they are given licenses. So, and we usually do follow-up. We do regular follow-up of these clinics to ensure that they maintain and adhere to the standards which are provided.
The government would say that we haven't gotten to the threshold of where we really want the numbers of physiotherapy to be. We have a ratio of where we have one physiotherapist vis-a-vis 1,000 clients that one physiotherapy has to do. So when you look at that ratio, it means that the profession has not yet sold enough in the society, but in the conference where we are, we tend to educate and enlighten the physiotherapists that we have, that they need to spread the message even throughout their hospitals and any other place where they can reach out, so that we have potential students. And we are also not looking at the Kenyan market only. We also have other international partners that they always sell the physiotherapy profession in their country, so that we are able to reach the global market.
What we are doing in KMTC is that we are also leading in the specialization training of physiotherapists. We have come up with 3 major specializations. That is musculoskeletal, where we are training orthopedic manual therapists. We are also training specialization in neuro rehabilitation for patients who have neurological deficits. We are training also in pelvic health, which includes women's health and also men who have pelvic issues. In lineup, we also have other specialization courses that are coming up. Major one being specialization in sports physiotherapy. We are also coming up with pediatric rehabilitation. We are coming up with cardiopulmonary rehabilitation.